Here at home, vaccine certificates have been suggested as a way to speed up reopening in some high-risk settings in Ontario. The Ontario Science Table says proof of vaccination could be used in places like gyms, indoor dining rooms, or larger events to help get the doors open sooner. In the long term, the Science Table suggests the certificates could be used as a standardized way for people to show immunization records. With more is Dr. Isaac Bogoch. He's an infectious disease specialist and a member of Ontario's COVID-19 Vaccine Distribution Task Force. Good morning, Dr. Bogoch. Thanks for being with us.
Good morning.
All right, I want to get your take, first of all, on this latest recommendation from the Science Table for these vaccine certificates. What's your opinion on that?
Yeah, so full disclosure, I had nothing to do with this document, but I like it. I think we have to be open-minded to this idea of vaccine certificates. And certainly we're not in a position where we're implementing this right now in Ontario, but we know that COVID-19 is not over. Yes, vaccine rollout is excellent. Yes, hospitals are decompressed and rates of COVID-19 are low. But we know that as we lift restrictions and public health measures, we're going to see a rise in cases. We know that's going to happen. You just don't have to look too far to see that happening. If we're ever in a position where our healthcare system is being threatened of being overwhelmed, this is certainly something that we should at least be open-minded to implementing to help preserve the economy and also protect the healthcare system. So, yeah, I know we're not implementing anything like that right now, but I think that this is a reasonable document. I hope people are at least open-minded to this concept.
What do you see as some of the potential downsides? Of course, there are people who are worried about their personal information being shared, or they fear that this will somehow be done in an unethical manner. How do you see this playing out if, in fact, it does come to fruition?
Yeah, I completely agree. And the details are extremely important. And the implementation, if it is ever implemented, would also be extremely important as well, right? You can't have discrimination against other individuals. So there might be, for example, people that, for whatever reason, age, language, mobility, who have not been able to get a vaccine, and you can't discriminate against those individuals. So there of course are some ethical considerations that need to be closely watched, and certainly there's always been this tug of war between individual rights and freedoms versus public health and public safety. This has existed long before COVID-19. It's going to exist long after COVID-19. But yeah, I mean, it's one thing to have a document that suggests that this might be a good idea, and another thing to actually implement it successfully.
And it's worth, I think, reminding people, Dr. Bogoch, that there are already vaccines that are mandatory, that you have to get before you go to school or before you travel.
100%. And even before you go to work. I work in healthcare, and certainly I'm not allowed to step into the hospital without evidence of vaccination for several contagious infections. School is another excellent example where you can't go to school without showing documentation of vaccination for many contagious infections. And then travel. I mean, there's over 60 countries on the planet where you have to show evidence of vaccination for something called yellow fever before entering various countries. So this has existed for a long time. And I think it's also fair to say that these are not normal times. We're in this interim period of time where Canadians are largely vaccinated, but we're not out of the woods yet. COVID-19 is still raging in many other parts of the world. Like, this pandemic is not over. It's not over. We're in a much better place now compared to months ago, but it's certainly not over.
A few seconds left. Do you think that a program like this could motivate people to get vaccinated when we're starting to see those first doses, doctor, kind of level out?
Yeah, it might. And we saw that happen in France, for example, where senior leadership in France said, there will be limitations to unvaccinated individuals. And literally right after that, the rate of vaccination just skyrocketed. So I think that would be a motivator for some who might be sitting on the fence. Of course, there's always going to be some people who are just not going to get vaccinated for a variety of reasons. But that would certainly motivate people who are perhaps on the fence.
Dr. Bogoch, thank you so much, as always. Really appreciate it. We'll talk to you again soon.